The time has finally come in our course to discuss the element of sex that intrigues many people the most: intercourse. Sexual intercourse is sometimes referred to as copulation or coitus. Although the term sexual intercourse has come to mean a variety of acts, the term coitus, which is Latin for joining together, traditionally refers to penile-vaginal penetration and is normally the fundamental first step in making babies. So in this video, you'll explore the physical and physiological elements of sexual intercourse. Specifically, you'll learn about the male and female sexual responses. But first, a bit of history. You might be surprised to hear this, but prior to the 1950s, very little was known about sexual intercourse. Sure, the mechanisms of sex were well understood, but very little was actually known about the physiology of intercourse. Repressive attitudes towards sex and a fear of professional sanctions meant that very few people carried out scientific research on sex. However, ever since the 1960s, research into human sexual physiology has become an accepted and very important part of the study of reproduction. And there are two very important people to thank for this. These people are William H. Masters and Virginia E. Johnson, better known simply as Masters and Johnson. And this dynamic duo pioneered research into the nature of human sexual response in the 1960s and 70s. They also investigated the diagnosis and treatment of many sexual disorders and dysfunctions. What was different about Masters and Johnson was that they didn't just interview people about sex, as earlier researchers had done. Instead, they directly observed and measured more than 10,000 sexual acts by nearly 700 volunteer men and women in their laboratory. This was groundbreaking to say the least, and pretty controversial stuff, but it generated some of the first laboratory data on the anatomy and physiology of the human sexual response. And it dispelled many long-standing misconceptions about sexual intercourse. If you'd like to read more about Masters and Johnson's work, I've provided links below this video to some of their most well-known publications, including Human Sexual Response and Human Sexual Inadequacy, which were published in 1966 and 1970 respectively. So here's a fun fact for you. The television drama series Masters of Sex, which aired from 2013 to 2016, tells the story of Masters and Johnson, who were in fact a married couple for 21 years, from 1971 to 1992. So from their studies on human sexual interaction, Masters and Johnson proposed that sexual intercourse could be divided into 4 different phases: excitement, plateau, orgasm, and resolution. Simply put, this model explains how the human body changes during sexual stimulation. The excitement, or E phase, is the first stage and occurs when physical or mental stimuli raise sexual arousal. In the second phase, or the plateau or P phase, this arousal becomes intensified. There is increased circulation and heart rate, and breathing is elevated. The orgasm, or the O phase, is short, but characterised by a sense of intensive pleasure. In both males and females, there are quick cycles of muscle contraction in the lower pelvic muscles, and in males, this phase is also usually associated with ejaculation. During the final resolution, or R phase, muscles relax and blood pressure drops to its pre-excitement level. In men only, Masters and Johnson also found that a refractory period occurs after orgasm, during which time sexual re-arousal and orgasm are not possible. In women, however, no such refractory period generally occurs. Sure, it can be difficult to tell precisely when one phase ends and the next begins, because real-life sex is a much more seamless process. But the beauty of Master and Johnson's model is that it does simplify a relatively complex physiological experience into a simple to understand process that most people can relate to. This is why their model is still relevant and in use some 40 years after it was developed. Next, you'll be able to explore an interactive that demonstrates Masters and Johnson's sexual response model in action. Use this interactive to compare and explore the 4 phases of the human sexual response in males and females. And if you're interested to learn about alternative models of human sexual response that have more recently been developed, I've provided some useful links to these after this video. However, I will stress that Master and Johnson's original model remains the most widely known and referenced model, so you will explore it in much more detail during this course.
Do you know which sexually transmitted disease is the most common in your country? We asked some students what the most common STI is within Australia. Let's see how up-to-date their knowledge is.
What do you think the most common STI is?
Chlamydia.
Chlamydia?
Ooh, herpes?
Is it herpes? I feel like it'd be herpes.
Chlamydia?
Chlamydia? I'd probably say chlamydia. I don't know.
HIV? No. I'm gonna guess.
I have no clue. No clue.
Herpes. I don't know. Yeah, I would say it'd have to be that because it's just like so common. There's so many strains of it.
Chlamydia is the first one that comes to my mind, so I guess I'll call it that one.
Some of the more common STIs are caused by bugs, microscopic bacteria and protozoa. In the previous video, most of the students we asked correctly identified chlamydia as the most prevalent STI amongst this population. But how common STIs are vary between places and populations. Recent global estimates are that over 4% of women and nearly 3% of men have chlamydia. These figures show the rates of 4 curable STIs, chlamydia, gonorrhea, trichomoniasis and syphilis in different regions of the world. You can see here that rates of different STIs vary hugely between regions. As many as 7.6% of women in the Americas are estimated to have chlamydia, but the rate's 4-fold lower at less than 2% in Southeast Asia. Chlamydia and trichomoniasis are the most common STIs in women across all regions, with chlamydia the most common in men. Chlamydia, gonorrhea and syphilis are caused by bacteria. These bacteria multiply in the host and can infect their sexual partners. Bacteria that cause chlamydia and gonorrhea are shed in an infectious discharge, and contact with the discharge is how the infection spreads. Syphilis can be spread by skin-to-skin contact. Trichomoniasis is caused by protozoa, tiny parasites. Many men and women infected with the trichomonads are asymptomatic, that is, they don't have symptoms. Trichomonads can only live in the human urogenital tract. These bugs can infect the urethra in men and the urethra and vagina in women, causing pain during urination or sex in some people. A vaginal infection can cause women to have lots of frothy and smelly vaginal discharge, which is infectious. The World Health Organization estimates trichomoniasis as the most common STI worldwide, with 142 million new cases per year. It's not common in urban areas in Australia, but not uncommon in Indigenous Australians. It's also common in developing countries, including many parts of the Africas and the Pacifics. These STIs that are caused by bacteria and protozoa can usually be treated with antibiotics. That means that many of these relatively common STIs like chlamydia, gonorrhea, trichomoniasis and syphilis are curable. One of the main effects of long-term STI infections in women is impaired fertility. The bacteria that cause chlamydia and gonorrhea can move up the reproductive tract into the oviduct and cause damage. This includes inflammation, also known as pelvic inflammatory disease or PID, scarring and adhesions, literally sticking together, which may block the tubes. Both of these bacteria increase the risks of tubal factor infertility. That's infertility due to problems with a woman's oviducts, which probably explains about 1/3 of female infertility worldwide. Up to 85% of female infertility is due to tubal factors in sub-Saharan Africa, where these STIs are common. Whether STIs also reduce male fertility is less clear. Untreated syphilis enters the bloodstream and longer term re-emerges as destructive lesions in a variety of tissues, This is called tertiary syphilis. The health impact of tertiary syphilis will depend on which tissues develop lesions. Lesions in the nervous system can lead to dementia or seizures, while lesions in the heart can cause valve disease or block blood flow to the heart muscles. Some STIs, like trichomoniasis, chlamydia and gonorrhea, also make the infected person more susceptible to other STIs, such as HIV or AIDS. Trichomoniasis infections in pregnant women also increase their risk for premature ruptured membranes and preterm delivery. Women may also transmit STIs, including syphilis, gonorrhea and chlamydia, to their baby during pregnancy or at birth. This form of disease spread from mother to baby in pregnancy is called congenital infection or vertical transmission. Congenital infection with STIs may lead to spontaneous abortion, neonatal death, severe disability or chronic infection. Congenital syphilis is transmitted from the mother to the baby through the placenta during pregnancy. It can cause abortion of the fetus, usually when the infection occurs during the second or early third trimester of pregnancy. Congenital syphilis can also disrupt fetal development or cause severe disease in the newborn baby or later in life. The World Health Organization estimates that syphilis in pregnancy leads to over 300,000 fetal and neonatal deaths each year and places an additional 215,000 infants at increased risk of early death. People with STIs may not know that they have them, so they could infect others. Without symptoms, those who are affected are also more likely to suffer effects such as infertility because they may not seek treatment.